Let's get more reaction now to Boris Johnson's plans to end all legal COVID restrictions in England. He's due to make that announcement a little later today. Now, Sammie Mcfarland is the founder of Long COVID Kids, which has more than 10,000 members worldwide and provides support to parents, carers and those young people living with long COVID, alongside Dr. John Price, head teacher of Worksop College and Ramsby House. Good afternoon to you both. Thank you so much for talking to us ahead of this big announcement we are expecting later on this afternoon. Sammie, can I first speak to you about your fears about this announcement, because you're dealing with what is seen as the legacy of COVID. You're dealing with that right now.
So thank you for having me. So I don't find that I'm fearful. I feel informed, and I don't think these are restrictions. I think of them as protections, and I am worried and concerned that if we're removing protections, we're going to see even more chronic long-term health in this generation of children.
Talk to me about the impact you're seeing on children who have had COVID, because from what I understand it's not just children who have been severely affected by COVID in the short term when they have the virus, but also those that have mild symptoms when they have COVID.
Yes, so the majority of the members of our group were not hospitalised. They did not have a severe infection. Most people had what they call a mild infection, which can also be pretty horrible, but as I say, not hospitalised. And then the symptoms can go on for many, many months. And for many of our members, they're now approaching the 2-year anniversary of when they got COVID, and they are still living with those symptoms. And these are symptoms which are impacting their everyday life. They're preventing them from being able to attend education, to socialise, to participate in normal activities that they were able to do before they got COVID.
And Sammie, what kind of ages are we talking about here?
So we have children, we have a baby I know of for 6 months, but mostly it's in primary and secondary age children, but we do have early years children as well. And for those children, they're missing their milestones. You know, some of them are reverting back to crawling, they're not communicating as they were previously. I'm really very worried about the long-term effects on these children and their development.
Let's bring in Dr. Price, headmaster at Worksop College and Ramsby House. If all the legal requirements, particularly self-isolation, were to go this week, would that be a welcome move? Because we know only too well the disruption it's caused to education.
Yeah, good afternoon, Sarah Jane. Yes, without a doubt, it would help significantly. I must admit, this sort of few weeks running up to half term probably has been the most challenging, would you believe, in the sort of 2-year pandemic. We had a number of staff who were off self-isolating across both sites, our primary and secondary sites, and just managing that whole situation, ensuring that we maintained, as we did, the pupils in lessons the whole time, being taught, whether it be remotely by staff who were well enough to teach, and then having to make sure that other staff, even the whole community getting together, even some of my support staff sitting in lessons to ensure that we didn't have a situation where pupils obviously were sent home. Because, notwithstanding what, your other guest has just mentioned about the long-term COVID situation, our priority has been the well-being of young pupils as well. And I've been sort of quite outspoken about that. The impact on them has been huge over these past couple of years, and it's vitally important that we try and get them back in the classroom and don't send them off back having to remote learn again.
It perhaps might not be the smooth transition some people are expecting, in terms of, we now understand that individuals are going to have to start making decisions about if they think they have COVID or have tested positive. They don't legally have to self-isolate, but they may stay at home the same way they do if they have food poisoning or the flu. And similarly, schools are going to have to start making those individual decisions as well. There's not going to be a one-size-fits-all diktat as to what you should do if somebody tests positive. It's going to be up to individual schools. So that itself could be tricky.
It could certainly be, but if you are, I suppose, the feeling is, if you are well enough and believe you're well enough to come in, we will mitigate every risk we possibly can here in schools. So maintaining all those other things that we've done for the past couple of years in terms of social distancing, making sure we sanitize on a regular basis, making sure, the staff have a separate box so they don't actually, have to interact too much with the pupils. So if there are vulnerable staff or obviously vulnerable pupils, again, we can try and mitigate as much risk as possible. But I think from the whole point of view of making sure that pupils are still in a classroom situation, it's a welcome decision if that is to be the case this afternoon.
Sammie, viewers won't have been able to see you, but I could see you just off camera there shaking your head rather. You weren't quite shaking your hands, you weren't that vehement, but you were shaking your head at what Dr. Price was saying there, because you described these measures as protections for children. What did you make of what Dr. Price was saying there about what schools are going to be doing going forward?
So I absolutely recognise children need to be in school, and this isn't about closing schools. In-person learning is so incredibly important for young people. But what we need to see is those schools safe places. We need to see, Dr. Price was talking about sanitizing. Well, COVID is an airborne virus, and there are not appropriate layers of mitigations in schools at the moment. And until there are, then we need to have precautions to really look after our young people and to be able to keep them in school.
And Sammie, you speak about this from a personal point of view, because not only do you have long COVID, but your 14-year-old daughter does as well. So talk to me about the impact it's had on your life.
So my daughter was 14 when she got COVID. She's now 16, and she's approaching her GCSEs. Her school attendance has dropped below 40%. She was previously fit, healthy, strong, no underlying conditions, doing well at school. And now she's very sadly unable to attend school. We've opted to do some home tutoring instead because school has become inaccessible for her. And she doesn't have the ability to catch up. She can't do extra lessons at home because of the cognitive symptoms that she's living with. The fatigue is ongoing, the abdominal pain is ongoing. She describes her life now as a half-life, and the families her situation isn't unique. The families in our group, they're living with the same experience, and our children can't go back to school. We don't have that choice. There is no support for children with long COVID in returning to school because they need such extreme amounts of accommodations to allow them to access education. So I'm worried if our children aren't yet better and more children are going to get infected, then how are the schools going to cope with rising levels of children who have special educational needs, need these accommodations and aren't able to attend mainstream
classes? Well, let's ask Dr. Price that question. Dr. Price, at your school, have you had examples of long COVID amongst your pupils? And Sammie was quite right there. Schools are under enough pressure as it is outside of COVID times. How do you support pupils who contract COVID and potentially have long COVID? What sort of systems can you put in place?
Firstly, I sympathise completely with what Sammie has to say, and obviously her family situation, and I understand and appreciate completely, the challenges and the difficulties. And we in education are all about trying to mitigate risk, trying to make sure that as much as possible we can be as safe as possible in this environment. And one of the things we would do, have been fortunate, I think, that none of our pupils thus far has developed long COVID. But if pupils are, and currently the situation has been that if they've been isolating with COVID, we will remote teach them. So that we maintain them within a community environment, making sure that at least still they're interacting, obviously, with their peers and with the rest of our community. And clearly, if that was a case, that long COVID pupils, we'd probably again ensure that was the case with any people that had that situation. I'm desperately keen that we ensure that the pupils are as much as possible back in this school environment, as I know Sammie is as well. And notwithstanding the fact that we have to try and mitigate risk as much as possible and ensure that for our whole community, because the difficulty we have at the moment is we're not totally sure who has and who hasn't got any symptoms and it is not positive in terms of COVID, because of course we're having to rely on parents testing. So that's another issue that we have currently to deal with. And I know of a number of people who have tested negative a number of times with lateral flow, and then when they've had a PCR test, although they're generally asymptomatic, have then tested positive. So it's been a difficult situation to balance from school's point of view, but certainly we're all about trying to make sure that the pupils have to be at the heart of everything, and it's trying to balance what is a very difficult situation and mitigate that risk.
Okay, Dr. John Price, head teacher at Worksop College and Ramsey House, and Sammie Mcfarland as well. Sammie, we wish you and your daughter all the best, and of course your continued work with all the children that have been affected by long COVID. You're doing some great work. Thank you very much.